Hello and welcome. Today, we're getting right into the new 2025 AHA/ACC Hypertension Guidelines, focusing on the changes that are going to directly impact how we protect our patients' brains. And let me tell you, these aren't just minor updates. We're talking about some major shifts in strategy against the damage high blood pressure can cause.
So let's start with a real-world scenario. You're in the ER. A patient presents with an acute intracerebral hemorrhage. Their systolic blood pressure is way up at 190. You know every minute counts. What is the precise, evidence-backed BP target you need to aim for to give them the best possible outcome? And here's another one to think about. Your patient just had a successful thrombectomy for a large vessel occlusion. Fantastic news. The instinct, of course, is to get that blood pressure down. But there's a specific point where lowering it further stops helping and actually starts causing harm. Do you know where that line is?
Well, the answers to both of those questions are now much clearer, thanks to the 2025 Guideline for the Prevention, Detection, Evaluation, and Management of High Blood Pressure in Adults, which you can find in the journal Hypertension. The overarching message here is powerful. Treating hypertension is fundamentally about defending the brain.
Okay, first up, let's talk about protecting cognition. This is honestly one of the most significant updates. We're moving away from a passive stance and into a really proactive defense against cognitive decline. Just look at the language change here. It tells the whole story. In 2017, the guidelines said lowering BP was reasonable, a good idea, sure. But now, in 2025, it's recommended. That's a Class 1, Level A recommendation. The evidence is now undeniable. We have a specific, powerful tool to help prevent mild cognitive impairment and even dementia. This is a game changer.
And this is the magic number. For our adult patients with hypertension, driving their systolic blood pressure below 130 isn't just for their heart anymore. It is now one of our primary strategies for preserving their mind, their memory, and their independence for years to come.
All right, let's pivot to the acute setting. This is where managing blood pressure becomes a real tightrope walk. During an acute stroke, the brain is in crisis, and literally every single millimeter of mercury matters.
This table right here is your new best friend on the stroke unit. For an acute ICH, we're now targeting a specific corridor. Get that systolic down to between 130 and 140. Notice the safety net though. If you dip below 130, you pull back on the meds. For ischemic stroke getting thrombolytics, the targets are familiar. Get them under 185, 110 before, keep them under 180, 105 after. But that last row, that's where the big news is.
And we really need to pause on this one. This is huge. It's the most critical, must-know update for anyone managing these patients. We now have a Class 3 recommendation for harm. The guidelines are explicitly telling us what not to do to avoid hurting our patients. And here it is, after a successful endovascular therapy, that brain tissue surrounding the infarct, that vulnerable penumbra, it's thirsty for blood flow. It needs higher perfusion pressure to survive and recover. We've learned from recent trials that being too aggressive and dropping the systolic BP below 140 in those first couple of days can actually make things worse. In this very specific case, a slightly higher pressure is actually protective.
So, once we're through that immediate crisis and the patient is stable, our strategy has to shift again. Now we're all about long-term protection. We're building a fortress to prevent another stroke from ever happening.
And the new guideline makes our job much simpler here. No more confusion. For any patient with a history of ischemic stroke, TIA, or hemorrhagic stroke, once they're stable, we have one unified goal: get their blood pressure down to less than 130/80. So how do we get there? Well, the evidence strongly supports our three main workhorses: a thiazide-type diuretic, an ACE inhibitor, or an ARB. These are the go-to agents, either by themselves or combined, to hit that target and keep our patients safe long-term.
But of course, we have to remember that none of these fancy new targets mean a thing if our initial measurements aren't accurate. Everything we do, every medication we prescribe, it all hinges on getting a good, reliable blood pressure reading. The guidelines really drive home the importance of mastering this fundamental skill.
So let's put it all together. How do we turn this information into an immediate action plan that you can start using tomorrow? Let's boil it down to a simple, brain protective protocol.
Here are your 3 key action items. Number 1, prevent. Be aggressive and target a systolic pressure under 130 in your hypertensive patients. You're not just protecting their heart, you're defending their cognition. 2, intervene. Know those new acute stroke targets cold, especially that crucial warning: do not drop the systolic below 140 after a successful reperfusion. And 3, protect. For secondary prevention in all stroke survivors, your goal is simple and unified: less than 130/80.
And if there's one phrase I want you to walk away with, it's this one: 130 to save, 140 to harm. Say it to yourself, write it down. 130 is your target to save the brain from cognitive decline. 140 is your new danger zone, the floor you shouldn't cross after reperfusion. It's a simple, powerful way to remember the 2 most critical new numbers.
At the end of the day, these 2025 guidelines give us a much sharper, more effective set of tools. We have clearer targets to shield the brain from the relentless pressure of hypertension, before a stroke, during the crisis, and for the long haul after. So the call to action is simple. Take these new targets, talk about them with your colleagues, and update your protocols. Let's put these brain protective strategies to work. For a full list of sources and our standard disclaimer, please check out the description below. Thank you for tuning in.